Hi, I'm Adil Fattar and welcome to this series of videos. These videos are part of your consent process, which includes the consultation with me, the written information I gave you in the clinic, and the letters in the post. These videos are generic and an aide-memoire, so feel free to watch them as many times as you like, jot down any questions you have, and I'll go through them with you in the clinic at our next appointment. If you're not one of my patients, these videos do not constitute independent medical advice and shouldn't really be used outside of the context of a consultation with me. Either way, I hope you find these videos interesting and informative. Liposuction in gynaecomastia is usually best in the larger frame gentleman or in an older gentleman who is more likely to have more fat than breast tissue. The liposuction removes the fat using tiny incisions. I generally use one incision in the armpit and one incision at the nipple. It's normally performed as a general anaesthetic day case procedure. When you wake up, you'll be wearing a tight corset or cycling shirt type garment. This is to compress the tissues to stop fluid accumulating under the skin and also give significant comfort and pain relief. After surgery, you'll be allowed to take this off and shower each day and check yourself for creases or areas where it digs in. After the surgery, you will have permanent visible scars where the liposuction cannula has been introduced. They may start off being lumpy, red, but should fade into fine white scars. They could form keloid scars. These are difficult to treat and may require referral elsewhere for management. You'll be bruised and tender in the area. You'll be given adequate pain relief to deal with this before you go home. You'll also be quite numb in the area. Numbness may last several weeks to a few months. It could be permanent. Initially, the result will not be your final result, and this will take many months to finally settle, soften, and form a normal, natural feeling contour. In the meantime, you may notice or feel palpable lumps or irregularities. You may see some contour irregularities. The vast majority of these settle in the first few months. Complications that occur include infection. This is in the region of 2 to 5%. This is rare, usually treated with oral antibiotics. It could be that you get a spreading cellulitis of the skin. This may require admission to hospital for further treatment. You may get bleeding under the skin. This is typically manifest as bruising. A significant collection of blood or hematoma can form a hard lump, and this may take many months to settle and soften over time and may require further corrective surgery. Sometimes fluid can accumulate under the skin in spite of wearing a garment. This is called a seroma. This may need to be drained in the office. This can be done with a syringe, usually through the numb skin, and is a painless, quick procedure. It may need to be done more than once. Rare complications include pigmentary changes to the skin. This is an inflammatory reaction to the liposuction and may take months or years to settle fully. It is very rare. Perforation may occur where the cannula enters or injures an internal organ. Fat embolism may occur. This is unlikely in localized liposuction, as in this case, it's more common or more likely to occur in large volume liposuction, where some of the fat is liquefied, absorbed into the bloodstream, and then lodges in the lungs, causing breathing difficulties. Local anesthetic toxicity may occur if the safe dose of local anesthetic is exceeded. Again, this is very unlikely in localized liposuction of the chest area. Aggressive liposuction close to the skin may result in skin blistering or skin loss, resulting in permanent visible scarring. Having a procedure under a general anaesthetic puts you at a risk of DVT or PE. These are clots on the legs, which may manifest as calf pain or breathing difficulties a week or so down the line. The procedure itself, in a localized area of the chest, is low risk in this instance. More commonly, people are critical of the aesthetic outcome. They may think it's overcorrected or undercorrected. They may not like certain contour irregularities, or may simply be unhappy with a technically good result. If you're interested, have a look at the general liposuction video as well. If you're interested in seeing the surgery, have a look at the video I've made for trainee surgeons on ibreastbook.com. Just go to the Gynaecomastia section.